Hi guys, how are you? So, exercise for high blood pressure, three must knows. In this broadcast, we're going to be talking about all about exercise, and especially if you've got high blood pressure, what you need to know as you embark on exercise. Okay, and it's gonna be three things that you probably never thought about, but you need to know so that you can effectively use it to knock down your numbers. And I know that is what you want for yourself. Maybe you've tried a whole lot of things. Maybe you've been taking so many different medicines, right? And you're not happy with your results. Maybe your BP is still high, or maybe you have so many things. Maybe you just find that the drugs are no longer working as they used to in the past, right? Or you're just plain tired. So this is also very important. This is something that you need to know, and you need to add to your arsenal of how to lower your blood pressure naturally. All right, let's talk about that briefly. As you come on in, drop live or replay in the comments. I really want to know. I want to connect with you as well. Okay, so if we're just meeting, my name is pharmacist Chibuamam Ilichuku, founder of Hypertension Africa, and of course known as Hypertension Manager. So today we're talking all about exercises. I know so this is our regular Wellness Wednesday series, where we just have a conversation around high BP control. And so today we're looking at exercises, all right? And of course, if you stick to the end, I'm also going to be sharing with you how you can also continue to work with us if you're looking to have better control. But let's talk about this thing. So basically, people ask, so is it just food? What do I have to do to lower my blood pressure and all that? So the number one thing you need to know about exercise is that exercise is a part of what you need to lower your blood pressure naturally. So first must know is that exercise is very important for anybody who has high blood pressure. It doesn't matter, even if you're doing well, you're fine, you don't really want to get off your medications, but you want better health, long life, and prosperity, right? Exercise is a must. Like, it's very, very important. All right, so it's part of what you need if you're going to be able to control your blood pressure better. So that's number one point you need to know. Now, the next point is like an extension of this thing. So yeah, it looks like, okay, so really I don't like exercise. I don't really love it. It's, I hate, it's hard. I don't have the time for it. It's stressful, it's strenuous and all that. So, but why is exercise part of it? Now, three things. Exercise does three things for you. Number one, exercise strengthens your heart, because you know that high blood pressure affects the heart and the blood vessels. Okay, somehow your heart is working super hard to push blood through. So basically, you want to strengthen your heart. You want to kind of strengthen it so that it's able to do the job more efficiently. And so exercise is part of it. So that is one thing. You want it to strengthen your heart. Number two, you want to improve blood flow all around your system. Okay, number three, you want it to, as it's improving blood flow, it's also now taking care, like flushing out a lot of toxins. So when you're sweating, you're pushing out waste. When you're eating yourself, you're pushing out. Even the process of breathing in and breathing out, you're actually getting more aerated. So basically, exercise is very, very important. Now this is the number two, is now very important, right? So number two, what you need to know about exercise is that you need to know what you want to achieve with the exercise. Now you need to listen carefully. So basically, if you've been following all our series here on the community, you would have noticed that we actually have an MBF formula, like a 3-phase step to high blood pressure reversal. This is what has worked for over 500 people who have actually utilized our methods and are doing very, very well without even everyday medicines. Okay, so part of what you need to go through is uncovering your triggers. You can drop that in the comments. Uncovering your triggers. Now this is like the basis of anything. If you're ever going to be able to wake up every morning to normal BP numbers, you need to know what your triggers are. Now, if you have uncovered your triggers and you find that you are overweight or you are obese, you see that the purpose of exercise for you is going to be slightly different from the person who is normal weight, who is normal weight. So what are your triggers? Have you uncovered your triggers? people that were on our BP Mastery workshop for January, they immediately knew what their triggers are. I got in a session with the client, now client at the time, and we found nine triggers for him. Okay, so for some people they find 5. So for some people we find 7. If you don't know what your triggers are, that is the first place to start. If you're ever going to be able to successfully wake up, maybe a month from now, wake up in the morning and check your BP and it's 118, you need to know what your triggers are. So that's why. So that number 2 is you need to know what you want to achieve with the exercise. So if you're overweight, for instance, right, if you are overweight, that tells you that you want to also use the exercise for your weight loss goals so that you can hit your ideal weight. Yes or no? Okay. And if you're obese, same thing. You want to make sure. If you're normal weight, you're not trying to lose weight, that's fine. So you also need to know what you're doing with your exercise. So it's kind of different for everybody, every single person, but it all depends on your goal. I hope this totally makes sense to you, right? So that's one thing that you need to know. That's a mistake most people make. I've been doing exercise yet. And let me tell you something. Some people do exercise every day and yet their blood pressure still remains high. We've actually worked with someone that she gyms. She goes to the gym. Like, she's very, very regular at the gym. Yet her BP is still high. She does supplements and all that. That is because, well, she did take care of all the other triggers, right? So these are some of the things. Like, I hope this is making sense to you. So sometimes we're just doing, I heard exercise is good, and you're just following the bandwagon, not knowing that if you ever want to, what we help you achieve is a holistic body repair, which is you are working your system to take it back to the original state where you never had hypertension. And the journey is different for everyone, right? So but you need to understand what you want to achieve with your exercise. That way you're able to hit your goals using exercise. Does this make sense so far? All right, number 3. Okay, so the number 3 thing that you must know is that you need to know that it's not all about gymming. Okay, it's not all about, so I have to register in a gym. It's not that. I think there was a time on one of these sessions we had something about like 7 creative ways you can exercise. So you need to know that when we say exercise, sometimes our mind just flies. I have to go and register in a gym. No, you don't have to. One of our clients, she's 60 years old. So let me explain to you. And then she's 60, right? So we found out that one of her triggers was she was overweight, right? So but we knew that you have to do exercise. You have to make it into a way that it can fit into your routine and that you can actually be regular with it. And so all she had to do is, I love to do exercise at home, so can I make it fun with my kids? And that's how she started doing it. Just 15 minutes a day, she was still able to reach her ideal BP with minimal drugs. When she started out, she was getting BP around 160s over 110, right? And then 6 months down the line, she's getting 118 over 70 something, and she's not even. And then when she was getting 160 something, she was on 3 different medications. 6 months down the line, she's getting 120 over 70 something with 0 sometimes. So she gets to kind of skip. So she's just on one drug and then she gets to skip it. So she's actually supposed to go for a review and let her doctors actually take off the last one. Why am I sharing this with you? She uses 3 principles. Number 1, she understood that exercise is part of the routine. Number 2, she understood what she wanted to achieve with the exercise, so she knew she wanted to actually lose weight with it. So obviously she was very, very conscious of that, and she worked her body every day. Number 3, she understood that she didn't have to go to a gym in order to make it happen. She could do it at home, and so she committed to it. Of course, there's a whole lot in terms of so how do I make sure, how do I do the habits, how do I make sure that I am able to follow through every day? How do I what of those are my triggers or whatever? Ask me your questions in the comments. But I need you to understand this, because this is what's gonna guide you as you try to work your body to be able to restore health. All right, even exercise improves sleep. Did you know that it improves sleep as well? So if you're already at a point where everything is just your body just haywire, exercise could be what you need. However, we strongly recommend you use it within the MBF framework, which is mind liberation first, body liberation, and then freedom activation. All right, so I know this looks like so where do you start? Now if you would love to work with us, you guys should ask me your questions. I'm not seeing any questions here or any comments, but I'm seeing people joining and on the live. So but ask me your questions, what it is that you would love to know around exercise. However, for the February workshop, we had January workshop last weekend, so we're having February workshop 26, 27, 28 for 3 days, which is where we actually work you through the whole process of high BP reversal. You would know for yourself what your triggers are, what you're going to be focusing on, exactly what you need to be doing at every point in time in order to be able to, in 30 days, be getting very beautiful numbers with or without your medicines. Would you love that? If you would love to join us for the BP Mastery Workshop, it's just $49 or 15,000 naira only. So if you'd love to join us for that, let us know in the comments. I will send you the registration link, and so we can get to work on that. All right, guys. So I hope this has been very helpful. Also know that if you've got friends and you want them to see this, they should come and see this. We're taking this down within 24 hours, and then that will be it. But I hope this really helps you as you try to hit your goal. Thank you so much for watching, and I'll see you around. Bye.